In today's video, I'm going to show you how to tape your knee if you're dealing with runner's knee. Another common condition we treat in the office is when we're dealing with a patellar tendonitis. A lot of times runners will get this because the quadricep muscle will get really tight, and when that happens it puts a lot of pressure on the patellar tendon. So to tape this, what we're going to do is we're going to use a piece of Rocktape. Rocktape is a brand of Kinesio tape. Kinesio tape is like a soft, flexible tape that takes pressure off the injured area and it helps it heal faster. It comes with this paper backing, and the tape is really like I say, soft and flexible, but you barely know it's on the skin once you have an injury, but again, it just supports the injured area and helps it heal faster. So what we're going to do, this is a piece of 4-inch tape. Rocktape sells a 4-inch or a 2-inch version, and we're going to use the 4-inch version because the quadricep area is a bigger area and it'll just take more pressure off the injured knee. So what we're going to do, we're going to cut off a piece. It's going to go up about mid thigh, and then it's going to end right around where the patellar tendon attaches right to the knee, that little bony area right there. And then what we're going to do is we're going to cut up about 5 or 6 inches into the tape, and that's going to allow me to kind of wrap around the kneecap area here and attach right here. So we already did that. So what we're going to do now is we're going to rip the tape, and we're going to rip it right where that cut ends in the 4-inch tape. And what I want to do is I'm going to rip off the backing of the tape, and you can see there's this weave pattern built into the tape, and that's one of the things that helps it heal and take the pressure off of it. So we're going to take that tape off. We're going to leave the tape on, or the backing on the cut area. What I want to do is we're going to apply it just like so. I'm going to rub my hands over it. The friction from your hands will make the tape stick. Now we're going to start to unpeel the cut area. And what I want to do is we're going to take the first piece, we're going to wrap around, we're going to anchor it. Then the other part of the cut is going to go on the other side, and it's going to attach right like that. Now you really want to make sure you secure the tape to the skin really well. Rip a piece of the tape backing off and smooth out the tape, rub it over it. The friction again will make it stick. Again, you want to really rub well on areas where the tape is overlapping, and that will make it stick better. And now the tape is designed to stay on for about 3 to 4 days. It can last up to 5. You can take it off at any point, just peels off like a Band-Aid, but it's designed to stay on for a while. If you get out of the shower and you notice one of the edges is starting to come off, all you got to do is let it air dry, and then take your fingers over it, rub it on the edge, and that friction will make it stick again. But again, it usually will stay on for about 3 to 4 days. That's one of the ways that we can tape for patellar tendonitis. The other way you can kind of supplement it is you can take another piece of the 2-inch tape, and we can kind of measure it up. It'll go right over, again, where a lot of the pain is, right in the front of the knee. So what I'm going to do is I'm going to rip this tape in half, peel back some of the edges, peel back some of the edges. Now in this case, we want to put about 25% of stretch on the tape. So we're going to stretch a little bit. We're going to anchor it over where the pain area is, right in the front of the knee. And then on the end, where I have the backing still on the tape, I'm just going to take it off with no stretch and just adhere to the skin. And smooth it out right onto the skin. And again, just another way to tape it and help take a lot of the pressure off that injured area. This we use in the acute phase to help patients get over an injury while they're still training. It also can be useful if they're in a high volume marathon training program, so they don't have to miss any of their time, or they can reduce it down but still not injure the area. If you have any questions, give our office a call at 703-912-7822.